Mitch McConnell is the Republican Senate Minority Leader. He was making comments to the press on the 26th of July 2023 when he suffered what appeared to be a medical incident of some sort. Let's investigate what may have happened and what the implications are. The most likely explanations are either a transient ischemic attack, otherwise known as a TIA, or mini-strokes, or an absent seizure, a type of epileptic seizure. A TIA is like a mini-stroke that produces stroke-like symptoms, but no lasting damage. It is caused by a temporary decrease in blood supply to part of the brain, which can last a few minutes to a few hours. Symptoms of a TIA can include sudden weakness or numbness on one side of the body, confusion, difficulty speaking or understanding speech, dizziness, or loss of balance and coordination. Recovery from a TIA is slow, taking many minutes or hours, and can be associated with significant levels of confusion. Absent seizures are brief, often lasting less than 20 seconds, and they involve a sudden lapse of awareness or consciousness. They're characterized by symptoms like staring blankly into space, not responding to external stimuli, and sometimes subtle body movements like lip smacking or blinking. A key characteristic of absent seizures is that people return to normal almost immediately afterward, without confusion. So while both can cause interruptions in normal brain function, the causes and effects are quite different. Absent seizures are a type of epilepsy caused by abnormal electrical activity in the brain, while TIAs are related to a temporary decrease in blood flow to the brain. I think that what Mitch McConnell suffered far more closely resembles an absent seizure rather than a TIA. Let's look at a couple of examples of medical videos used for training purposes which show absent seizures.
This girl has absence seizures, and you will see her have one while she's talking.
Because he can be as heavy as ever.
And there's a real blankness, a vacant look in the eye, and then all of a sudden they're right back with you and able to engage.
Oh, pardon?
Sorry?
I thought you said something.
Absence seizures can be mistaken for daydreaming. One of the hallmarks of absence is that the seizures happen many times in a day. Sometimes they're so fleeting, they're easy to miss. This boy is having frequent but very brief episodes. You can see his eyes flutter up. He's out of touch. Then he becomes fully aware again.
And now let's look at Mitch McConnell's episode again. Note the sudden lapse of awareness, the staring blankly into space, the lack of response to external stimuli. There's no evident lip smacking or blinking, and unfortunately the camera doesn't show his fingers, which may exhibit a writhing motion during absent seizures. What causes absent seizures? They are a type of generalized onset seizures, which means they start in both sides of the brain at the same time. The exact cause isn't known, but it's likely a combination of genetic factors and brain chemistry. Certain circumstances, such as hyperventilation or flashing lights, can trigger an absent seizure in susceptible individuals. Anything which causes damage to the brain structure or function can also increase the risk of developing absent seizures. So, a history of falls, concussions, stroke, or any other traumatic brain injury is particularly significant. Mitch McConnell has had a history of concussion following a fall in March of 2023, as well as several other less serious falls this year. This history may increase his susceptibility to developing absent seizures. In terms of treatment, anti-seizure medications are the most common approach. These can significantly decrease, and in some cases completely stop absent seizures. Every person is unique, so it's important for a healthcare professional to tailor the treatment plan to the individual's needs and circumstances. Link to cognitive issues and dementia. Given Mitch McConnell's role as Senate Minority Leader, there is understandable concern about any link between absent seizures and cognitive issues or dementia. Unfortunately, it's a complex topic. Some studies suggest that frequent untreated seizures could lead to cognitive impairment over time. However, this is still an area of ongoing research, and absent seizures are typically not directly linked to dementia, so the simple presence of absent seizures isn't proof of cognitive decline. It's crucial to remember that managing and treating seizures is the best way to reduce any potential impacts on cognitive function. It is important to state that I am not Mitch McConnell's treating physician, and I have not fully assessed him, nor am I diagnosing him. I think his case is, however, a very good publicly accessible example to explore absence seizures and explain what they are and aren't. Remember, if you or someone you know is experiencing symptoms like these, please consult with a healthcare professional. Either a TIA or a first absence seizure is a medical emergency requiring urgent medical review and appropriate treatment. Thanks for watching. If you found this video helpful, please like, share, and subscribe for more videos about psychology, psychiatry, and mental health in general. Until next time, take care of yourselves and each other.